Hello, my name is Michelle Wynn. Today I will be performing the oxygen administration skill. I am in my appropriate school uniform. I don't have any jewelry or nail polish on. The supplies that I'll be using today, I have a patient, I have my hand sanitizer, I have a nasal cannula, I have a non-rebreathing mask, and I have gauze. Oxygen is considered a drug and it does require a, a practitioner's order. Therefore, we need to verify the details of the order. We will be checking the oxygen delivery method, the flow rate, and the duration of therapy. Once that information has been determined, you will gather your appropriate supplies. You will go to the patient's room. I'm going to knock before entering. I will close the door behind me to ensure patient privacy. I will introduce myself to the patient and place my supplies down on a dry, flat surface. I will perform hand hygiene and I will verify the patient's identity. I will check their wristband and have them verbally tell me their name, first and last name, and their date of birth. Once that information has been verified, you will proceed. Thank you, Mr. Jones, for verifying that information. I will be applying oxygen today. The doctor has ordered some oxygen for you. So we will be using a device called a nasal cannula. This device will be attached to your nose. The other end will be attached to the oxygen flow, and you'll receive additional oxygen. So I'm going to connect this to the oxygen source. This device can give you anywhere from 1 to 6 liters of oxygen per minute. Anything that exceeds 4 liters will also require a source of humidification. So the doctor has ordered Mr. Jones 3 liters. Mr. Jones, is it okay if I apply this? I will be putting this in your nose or your nares, and I will be connecting the tubing to your ears and underneath your chin. Is that okay? Okay, thank you. Okay, you want to adjust this to make sure that it's snug, not too tight. Mr. Jones, are you okay? Does everything feel comfortable? Okay, perfect. Okay, so some time has passed, and the doctor would like to increase the oxygen concentration. So we are going to remove the nasal cannula and apply a breathing, a non rebreathing mask. Okay, so I'm going to remove this and I will dispose of this. Okay, Mr. Jones, I am going to apply a different type of mask. This will provide a higher concentration of oxygen for you. So this is the mask and it has a reservoir bag. Once the oxygen is flowing through the mask, this bag will stay inflated. Now, if this was a partial rebreather mask, one of these valves would be removed. Currently, there's two, and one would be removed. So I'm going to attach the tubing to the mask. I will attach this side to the oxygen source. And with this type of mask, the oxygen is 15 liters per minute. So that's what we will make sure that the flow meter is at. We'll make sure that the ball is at 15. Okay, Mr. Jones, what I'll be doing is I will be placing this over your nose and mouth, and I will put the string behind your head. So let me first put it on your nose and your mouth, and now I will put this around your head. How does that feel, sir? Okay, perfect. Let me just fix this a little. Okay. Everything is okay? Okay. It's important to assess your patient at least every 2 hours for any skin breakdown. With this type of device, it can cause irritation, it can cause redness. So you'll be checking the skin integrity. Even if you don't see anything, you may want to take some preventative measures and apply this extra padding so that no irritation does occur. Some of the frequent areas where patients do experience irritation is in the cheek area, around the nose, or behind the ear. So I'm going to apply this behind Mr. Jones' ear and in the cheek area. Okay, how does that feel, sir? Okay. So normally, if he was wearing the breather mask, we want to at least check him at a minimum of 8 hours. Every 8 hours. However, you would make sure that you check your doctor orders because the doctor may want you to check more frequently. So the time has passed, and Mr. Jones is at a better oxygen level, and the doctor has ordered that we remove the additional oxygen. Mr. Jones, I am going to take off your gauze. I'm going to dispose of this, and now I will take off the mask. I will dispose of this as well. Okay, Mr. Jones, are you okay? Are you feeling okay? Do you need anything? I'm going to place your call light near you. If you need anything, just call us. I'm going to perform hand hygiene, and then I will go and document what I did and Mr. Jones' oxygen levels.